Welcome to Omega Medical Center, Code Blue, Episode 5, ICU, Management, ER Trauma, and we will look very close at Dr. Kareem Clemons, who will be in the emergency room and going back and forth to the hospitals. This is OMC Code Blue. Welcome. Today is 1/8/2019. Happy New Year's, everyone. Let's dive into the game. We are already on day 17, and I just activated a crash, and they will be coming or on their way. So, without further ado, let's go ahead and play the game. And I know that I have to go to this and lower this down. Okay, so real quick, matter of fact, I wanted to make some points in the game. Just hold on 1 minute. All right. Okay, so all right, so I want to make some viewpoints on what happened on yesterday at OMC, where we had a very, I don't know what to say, but so many patients passed away in our ICU. And if you look over here at our intensive care, it was down, but unfortunately it had gone up because of today's procedures. But we had a lot of patients dying in intensive care, and also we had a lot of patients going to intensive care, and that was because we didn't have any beds available over in any of our departments, which I'm not understanding why we didn't have any beds available. But I believe that is because they were filled, or I have to see what beds is to whom and to where. And I do know that some of the beds were high dependency, and those are like somewhere around ICU beds, similar, but ICU is just more. Okay, so we have surgery going on right now, done by Mr. Wright. Okay, so we just received an objective. We just received 50,000 from the government, uh, who who just gave us 50,000 in the grant because we just completed something. So this, okay, come on. All right, surgery is happening on. Oh no, who is this person? Okay, Elizabeth Williams. So it looks like she has. They're doing eye surgery. Okay. All right. So yeah. So we'll definitely be looking at ICU today. We'll definitely be looking at Kareem, Dr. Clemons. He should be in today. I think he is. Okay. So this is how we follow him. We just press this right here, and we will actually follow him wherever he goes. We do know that he is getting some experience in the ICU, and we do know that, oh, he's going to the bathroom. We don't want to watch that. Okay, we do know that he's up at the ICU and he's doing his thing. Okay, so it looks like Michael Harris is waiting for a bed in orthopedics, and Thomas Lopez. Those are both of our patients, I believe. Let me see. Harris, yep. Scott and Gonzalez. Okay, so it seems like the patients is giving their dinner. They must be waiting for somebody to come. Okay, so with that being said, they say we could put him in ICU. Let me see if I can just. Okay, we're waiting for a lot of beds everywhere. Let's see if we can put him in general surgery, right? And let's see if we can put this guy in general surgery too, if it's high dependency, waiting for a bed. Great. Let me see. I want to go over this review that happened at OMC yesterday real quick, but I want to deal with this first. They're running, so I don't know what they're running for. I think they're about to wait. They're waiting for someone to come, I believe. Let me see. Judy, where is she at? Okay, I think she's in the elevator. I think she's about to go to the ER. Yep. All right, they waiting. Somebody's waiting for her, and then who are you guys waiting for? Oh, he's in bed. All right, go back to him. Let me see what's going on with these guys here. This is our TC. Let's see. What's up with you? You need all this. And cardio. If we can, I know we're waiting for a bed over there. Let's do a physical. And I think at 12 o'clock they all disperse, like they all leave. And I found out what this is here. This is a satisfaction. So I guess once when this is up to 5-star, they'll leave the hospital. Okay, we haven't got a clear diagnosis for you yet. We're running your test. You having dizziness, and we'll give you some of that. That take care of it. You're having pain, limit leg motion. We'll give you some of that. And you have a bruise. We don't know what you have. It seems like it's going to be ruled out as a leg contusion, which is showing signs of that. And there's no, okay, there's proof of that too. All right, okay, let's see. And I still haven't got over to my lobby, like getting the lobby all under construction and everything. I wanted to change that around. Okay, let's go to Barkley Harris. Margaret Barkley. Okay. Cold blue, cold blue. Cold blue, cold blue. Let's do blood draw and let's get her the CT and MRI. And she has she has this here to indicate that there's something hidden and she may start collapsing. Let's see her signs. Okay, this is definitely not good. Her heart. She needs this as soon as possible. Let's follow her real quick. Oh, I think we follow her. We're gonna see where they're taking. I think they're gonna take her to the ER. Okay, hold on, Mr. Harris. I think you're down here too, Harris, too, right? Okay, Harris, are you here? That's Lopez. I know Harris is one of my patients that I have to find a bed for. Where you at? Right here. You need a blood transfusion. And where are they taking you to? They taking you to ICU? They are taking you to ICU. Okay, Okay, so Mr. Harris is now in ICU. And this is one of the patients that came in. So hopefully he's stabilized and they can suppress this right here. Okay, so let's see. If we give him this, he needs fraction surgery. Bed required. Okay, so we don't have. Yeah, there's a lot of people going to CAT scan. His blood transfusion. Come on, give it to him. He needs it. Bed required. I know there's a lot of people in CAT scan. Are you going to him? Okay, the doctor's already there. This is Charles. Okay, the clinic just closed. Okay, let's do that for, this is a different diagnosis. What is it? Special case review that reduce the amount of, okay, he's sleep, and it's in a change of shift too. It is a change of shift. So hopefully he doesn't code during this shock, because if he does, then that means we don't have any doctors. So let me take this time out to go over what happened yesterday at OMC. It was a couple of things that happened at OMC on yesterday, which I wasn't really happy about. And that was because, number one, and since I'm here in ICU, I want to talk about how one of our patients who was over here, and they were over here, and I believe it was Joseph Green who worked here in this department. I believe it was a patient by the name of Mr. Martin, who was going into cardiac arrest, and Joseph Green, he actually, the EKG was right here on the table, but he went all the way over here, and he went. So I'm not really sure why this wasn't in favor. I'm not really sure why this wasn't working. Okay, the department can't diagnose Michael. So I'm not sure if it's because they can't access this, or I need to change this. But that was sad. Let me see what's going on here. Who was it? It couldn't do. Okay, so let's see. Let's give you this. This is cardio. Okay, patient is collapsing. Cold blue emergency department. Cold blue emergency department. Okay, that's because there's a change of shift. Okay, let's go. Harry, thank you. Okay, he's defib, needs to be shocked, heart monitor, and I think he needs to go into a high dependency. Let's do something. I think it's his leg that's bothering him. But it could be any of the possibilities right here. This man could either can go to internal medicine. He could probably go to neural. We just use neural. He probably can go to cardio, but right now he's emergency. Okay, so Charles Brown is collapsing again. This must be his brother, because William Brown is collapsing. Now patient Charles Brown is collapsing. Oh, he's like right here in the same bed. Okay, so cold blue emergency, cold blue emergency. So he needs to be defib. So that's crazy. So are they brothers? This is Charles Brown and this is William Brown. He's 76. He's 27. And they both seem like they have heart failure. He's definitely been suppressed. His heart is definitely being shocked right now. He's defib. Yep, they're both brothers. He's younger, he's older. Dizziness, chest pain, headache, heart failure. Let's do a stool and let's do an MRI. And let's do your blood. So yeah, these are two sick individuals. They're very sick. Okay, it seems like there's only one for him. Oh, no, it's not. There's multiple for him. He may have that. Let's do this. Oh, I can't say. Yeah, he's gonna start him on these drugs because. Oh man, he could have. Does this require drugs too? Antibody, antibody, antibody. Okay, stand and hold your line. Deal with two critical patients here. Actually, two brothers. Okay, so let's see. Mr. Charles Brown, I went ahead and put this here, the meningococcal meningitis. And then he has a symptom there, which could be too hidden, but he's already, okay, it seems like his symptoms has been suppressed, but his chest pains is medium. He's been given all these drugs. We can send Mr. Brown to ICU if we needed to. Okay, so employee got drunk. We did the objective ensure has been completed, reached 80% prestige. At the end of the day, Nora received next two interns available for hire will be great candidates. Long wait, bed require. Yeah. Yep, bed require. Yep. 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 So hopefully people just left the hospital. Hopefully. I'm pretty sure he's going to ICU. Let's follow him. Also, yesterday at OMC, there was two patients that came in. One by the name of Linda Gonzalez, and the other one by the name of John Foster. And they both had a brain injury. Of course, Mr. Foster died at 4:19 p.m. of the same thing that Miss Gonzalez managed to hold on and succumbing 2 hours later. My thing is that they were being treated doing the same thing, like same medicines, but unfortunately, I believe Mr. Foster was older man and the medicine wasn't really working. But we didn't really know like their medical history, so that's like something that we don't really know in the game, their medical history. Because, like for example, Mr. Brown, we just know that he has this, but we don't know. He's probably cold. Okay, no, he's going to sleep. Okay, so he's being treated too. So we don't know what's his history and what's actually, if he was taking any medicine at home. But we do know that I actually put this here. But that's if we can start the medicine. That's only because I looked at these other possibilities. And it says 43%. We don't have a bed. I apologize for that. Yeah, that's 43%. But it doesn't show any type of other symptoms. So I may be right, I may be wrong, but right now he's receiving IV antibodies, and if it was the case that he had meningitis, it will actually serve with this because he needs that, and it will actually nope, not that. Well, is he receiving it? Yeah, he's receiving. Okay. Iron suppression. He's not on iron suppression. Lupus. Okay. Okay, hold your line. We don't even have a surgeon for that. Okay, so we're gonna actually hold out, watch out for Mr. Brown. Let's favor him, and then let's go back over here. But hopefully they will, hopefully Mr. Brown will get better. All right. All right. Yes. Also, too, we were having problems with our janitory, with the housekeeping, not cleaning up the blood. There was so much blood in the emergency room yesterday. It was crazy. It was so much blood. Okay, so it looks like his other brother is gone. He was in his bed right here because they were bed. Okay, so hopefully we're doing something to make him feel better. Okay, what's happening to Mr. Cole? He's still having redness, and he's taking his medication. Hopefully, let me see. Is there any beds available? Okay, he's going to be transported over there. Good, Mr. Cole. Okay, let's see. Barbara Barkley, you have a nasal fraction. Your X-ray. Let's see if we can get you to orthopedic. Do you have any beds? Okay, there is no beds available. Let's keep you here. Okay. I apologize for that. Also, what type of insurance you have? You're uninsured. That's probably why. Okay, so let's see what's happening to Thomas Rodriguez. You have uh, a disease. You need to be sent to there. You're still waiting for a bed. If we do that, we're starting you on that right now. Okay, it says regular hospitalization is good, and it says we can send you to ICU, but I don't want to do that. They got on my ass for sending too many people to ICU, and they're like, "Well, why are you sending people to ICU?" Because we don't have any beds available over in regular, the regular hospital. So you need to go general, but I doubt it. Let me see. Waiting for a bed. Start this and start that. Okay, let me run upstairs real quick to see what the heck is going on and why we don't have any beds available. Okay, what floor are we going to? Up. There we go. Over here. All right. Boom. Wow, we don't have any beds. It's 1, 2. Okay, let me see if we can heal some of these people over here. Let's see. You're waiting. Okay, they say you can go to ICU. They say you can go to ICU. Harris. Oh, come on. You can go to ICU. Looks like you're getting better, so I will say no. You're having this you need this. You can go to high dependency, but I don't really know where that at. I will have to see where high dependency is at if it's on this floor. Okay, you have this. You're already on your treatment and you're sleeping. Okay. Let's give you this. Let's go to. Hold on, let me go to the emergency room. Look like we just received somebody coming in. Okay, let's see. Okay, 2 o'clock in the morning. We're receiving someone. Okay, welcome to OMC. How can we help you? Okay, Mr. Foster, how can we help you? Okay, we're gonna give you this. We're gonna do physical exam. We're gonna draw some blood, and it looks like you have carbon monoxide. Okay, so let's go ahead and heart monitor you, and yeah, you definitely need to go to ICU. Take him to ICU and then give him that. That's what he needs. And he's Yep, we got you, buddy. EEG. Alright, boom. And he's in the red. What's up with you, brother? Okay, bed required. You've been here for a while, Mr. Scott. You're one of our patients. You're still waiting for a bed. Wait, we have beds available here? No. Let's go to no. We can see you there, the cardio. Oh goodness. Yeah, let me watch him because I need to know where he's going because eventually when the bed is up. I don't think we're gonna get all this. It seems like Gonzalez has been cured. We're waiting for actually Judy Hall's been cured. We're waiting for Gonzalez. Which Gonzalez is definitely sleeping. He's a manager and this is insurance. Okay, he's not getting any good. This one, Peter Scott. Uh, 62, he's not getting good. We have Michael Harris. Wait, what's up with Harris? Oh, he's still in shock. Where's he at? He's in ICU, man. He dies. We lost the grant if he dies. Yeah. Mm. Yeah, we have a red one. We have this. Hmm. They were already suppressed and everything. Mm. Mm. Discomfort. He needs surgery, right? Yep, he needs surgery. How many times he's been shot back? Oh, he hasn't even coded. Um, it's just the shock that we need to get under control, and it's very high. What does this mean? I don't know. Uh, okay, Margaret Barkley is collapsing. Oh wow. Yeah. So defib. Okay, she's cold. So it seems like she has this problem. Let's get her on a heart monitor and watch her heart because apparently she has heart failure. Let's do a stool. We need to see what in the hell is wrong with this lady. Let's see. Is 52 coming up with this? Why is that? Only because of what? The symptoms? Hmm. Never heard of this before. What if we do this? What's this? Pre-ERT. We'll be able to give her that. She'll be able to take this. Ooh. Wow. Vitamin deficiency. What's this? Vitamin deficiency? No, enough says supposed to result in nutrition. If and this is vitamin and immunity component, and then you have a. This would be a good time to look this up on here. Okay, the clinic is open and the day shift is coming in. Okay, so oh wow, what a coincidence. So now Kareem becomes the specialist on her. Okay, so let's do this. Let's order all these exams right here so we can rule out what possibility of diagnosis Miss Barkley could have. All right, it's been a change of shift. The clinic is open now, so hmm, where's Kareem at? Oh, he's right there, right there. Look at all those employees of OMC making their way to the hospital. Hmm. He been standing there for a while. So look at everybody that work at OMC. Now, where they going? Hmm. Okay, I know y'all need to not be walking slow like that. Come on, hurry up. Hurry up, hurry up, hurry up. Hurry up, hurry up, hurry up. I try to fast forward it, like fast, so they can get to their jobs real fast. Okay, so we see that she's under the care of Kareem Clemons. Okay, so I think this time we want to take this time to watch Mr. Clemens and see what he does. So let's watch him. We have 6 minutes and 20 something seconds before that episode is over. Right, but we're gonna watch Dr. Clemens and see what he's up to. Mm. No? Mm. Mhm. I think this is really good. Mm. Mm. Mhm. 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 Okay. Okay, do we have any patients? Okay, so this needs to be cleaned. You need to clean this up. And do you need help? Let me see. Okay, how many janitors do we have here? Um, so it seems like everybody's working. Uh, I don't really need all these receptionists, registered nurse, nurse specialist, nurse specialist, nurse specialist. I don't really need all these. Oh wait, does it tell you? Is this the number of people to tell you? I think once when we get a full room, I'm gonna come back to here and see if that number is what I think it is. But I'm pretty sure it is. Also too, I want to show you guys something. Uh, radiology, I need high. Surgery. All right, so we don't have a corridor, but where is this at? And I want to see something. If we could put, I don't understand why this doesn't work. Because here's our corridor right here. So I don't understand how, and we don't have a chief doctor either. X-ray room, restroom, corridor. See? Can we do it? We can't do it. It's not gonna make us make a corridor. I don't know why. Um, what does a corridor do? A corridor marks corridor as a room type to assign areas equipped to a department and enable automatic lights and janitor cleaning service. I don't understand why I can't. Let me see. Let me see. Remove room. Okay, I was able to move that. Okay, I was able to do that. So now can I do it? Like corridor. Okay. Okay. Is this a corridor too? Four corridors. No, I don't want that many corridors. Oh, that's probably why. Oh, wait. Hold on, hold on, hold on, hold on. Hold on, hold on. No, 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 no. No, 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 no. I think I see. Wait. Oh, this isn't the corridor. This is. What is this? Wait, if you put the rules up, what does this? Okay, so this shows the corridor here. Okay, so hold on, hold on, hold on. So if I come here, you have to come up the elevator, come here, or you can go there. Oh, they just walk around? Wait, who sits here? Oh, one side is. Hmm. Yeah, waiting room over there. Okay, we just gonna leave that alone. Alright, someone just came in by ambulance. Okay, welcome to OMC, Mr. Hernandez. Seems like you have a pneumonia. Let's see this is the chest, physical, X-ray, and see if we can switch you over here and do that. Okay. Okay, so it looks like our ER is cleared out at this time. I'm not really sure again if we're gonna be getting this, but again, Michael Harris, he still have a cold here. Not really sure if he's getting better, but his shock is still high. Lopez, he's definitely walking around right there. He's going to bed, they say. And he has a fracture he's waiting for leg cast. And Scott. What's wrong with you, Scott? He's in the bed sleeping. Okay. Alright. Alright, let's go down. Alright, welcome to OMC. Mr. Garcia, what's wrong with you? We don't really know, but if we do all these tests, we can see what's going on to rule out if it's these possibilities. But you having symptoms for all these, and it's gonna be probably. Nope, that's. Yeah. So you have a solid chest. Chest is a life-threatening condition that occurs on the rib cage break due to trauma. What can it for? Well, they're not saying anything wrong. Alright. So OMC, you're in the right hands. Okay, it seems like Mr. Lopez is doing better. So now we need Michael Harris to pull. I doubt it. They're gonna take this 50,000. You're gonna take this 5,000 away from us because I don't think Mr. Harris is gonna get better. He's already in the high. We see that Mr. Scott just got better. His stars just went up a little bit, so his certification has gone up. Hopefully we can get this done before our time run out. We have 4 minutes and 28 seconds and counting. You should be going to a room right now, right? We don't really know where you can take you at. Christopher Taylor is your doctor. Alright, so let's see where Kareem at. Let's toggle him. Okay, right now he's going to his work spot. He was just up here talking to one of the patients here. I'm gonna watch him for a couple minutes. But yes, also too, when we was told that, oh yeah, we did see that surgery at 2 o'clock in the morning. That was amazing to see a surgery happening. I believe in cardio, a surgery is happening at 2:30 in the morning, and they were working on this patient. And I'm not really sure if that was one of the patients that had went upstairs from the ER yesterday, but I do know that our ER was packed and it was a lot of blood. So we had a meeting. We spoke to janitorial. We made sure that I have to see, but I believe the only way we can do that is if we assign them to a work area. So for example, I was looking at this too. So we have is this a janitor? Okay, this is a janitor. So let me see. I think we can assign him, right? Okay, assign him to a workspace. No, how do I do that? Okay. Oh, okay, so it's that workspace. Is that type of workspace? Okay, so no problem. All right, no problem. Okay, so the workspace will be indicated on if it's availability in those areas, meaning that, meaning this here, if it was the workspace available on here for janitor, we could fill them in. It told us to, like right here, we have 197. I have to see something. Because it's saying here, build and hire staff that, We completed a lot of objectives. Okay, so we completed this objective, we completed this objective, we completed this one, this one, this one. We have to treat 7 more patients for this one, but it's telling us to build and hire the sonograph. Where would you find this at? Let's see. Okay, what do you do for this? Where do you find this at? Sonogram. Uh, it says build and hire for sonograph. So we do have one of those, right? Right? Don't we have one of those? If we go to radiology, MRI, a CT. Let's see who we could put as a. Oh, we don't have no chief doctors. There's no doctors and radiology, which is kind of crazy. We only have technicians in radiology. Okay, so let's see. Um, let's maybe it has to do with internal medicine. Okay, let me see. Okay, I don't even know what room this is. Okay, do we have anybody in this room? Wait, hold on. Let me see what room this is. Okay, what's this? Neural. So let's see. Bio, bio, bio. We are gonna give me somebody with neural. I need. That's what I'm saying. Yeah, give me somebody neural. Thank you. Well, he's higher than you. Well, she's higher than you. Okay. And then maybe it's this room here. This is neural. Hmm. Let's try this department. Okay, we're gonna need. Oh, we have 199. Darn. And there's no. Okay, we could at least hire one janitor. Let's do you. You seem fast. We at 200. Let me see something. Who we don't need. Let me see. Probably in the nighttime. Okay. Okay, we have too many doctors. Intensive care. I'm about to get rid of somebody. 96. A nurse. Hmm. Uh, I don't know like who used those rooms. It says it's 0 cardio tech, 0. Okay, this is night. This during the day. Doctors, we only need 3, but we have 5. Hold on, let me see. Just take off a doctor. Okay, dismiss. Fire your doctor. 1. But we only need 3. Dismiss. Okay. At night, we only need 1 doctor at nighttime. Let me see who we got at night. We could take you off. And we could take you off. And then we have 3 nurses at nighttime. We don't really need that many. Let's get rid of another one. Okay. 6 stretchers, 1 surgeon nurse. And we have a cardio tech. Let's put in this, a cardio tech. We need cardio, that's you. And you. Alright, now let's see if things work. We still have 198. That didn't help. Alright, okay, our patients are about to come in now. And then I'll be able to check this number to see. I'll be able to check this number to see how many patients we have. Night, see, look at this. Night doctor 6, but it says we need 1. Let me see. Okay, 6. That's because I didn't really know what I was doing. Okay, so let's see. Yeah, we'll leave it to Kareem. His daughter. Yeah, I just made his daughter. Okay, you could go. You could go. You could stay on. How many nurses? 10. Damn. Let's go. Goodbye. Where's our other nurses at? Where's the rest of our 10 nurses? Okay, so at nighttime, night shift, we have 9 nurses. Okay, you don't come to work. 8. Where would our other be? Other ones? Let's see. We have another department. Oh, okay. 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 You can go home. Goodbye. We only need 1 nurse. Maybe we can hire those remaining people who is being a janitor to get this place clean. Okay, don't bother coming to OMC tomorrow. I should have maybe oh, look at this. This is no, that's not the lab we need. Okay, let's go. Pissed. We got fired. Alright, so it looks like no one's in the bed over there. No one's in these beds. No one. Oh, wow. I thought we were going to make a comeback with nobody in the beds. Okay, you taking. Okay, so we almost there. With the emergency room hospitalization being. Oh, is that breakfast? That is breakfast, but I can't zoom in. Oh, he's eating breakfast. Okay, nice. Well, he's not eating. Well, she's not eating because she's not with her. Yeah, the patients are getting breakfast. Look, breakfast. Hold on, let me see something. Let me see what these guys are getting over here. Are you guys getting breakfast? Breakfast? Okay, they got some breakfast. Okay, nice. I extended the hours for breakfast. 8 to 10. Let's see what's happening to you. You're getting better, Mr. Lopez, hopefully. Alright, so we have 2 minutes and 54 seconds on this. Yeah, so I don't think we're gonna be getting this one. Oh, he needs that. Oh, she needs that. Let's see, Gonzalez, where are you at? You're still... You're in bed. Oh, God, I hope I didn't scratch my eye. Oh, it hurt. All right. Okay, lay cast now. Okay, we just did you and the quickness. All right, 2 minutes. Let's see, Mr. Scott, where are you? What's going on with you? You still need surgery. So we can't give you surgery until this is all fixed. Your symptoms are still high. You have 4 high ones. Michael Harris, you're still in. Richard Garcia, hold your line. Okay, I don't think we're gonna get this one. Patience collapse from Barclay. Okay, let's go to her. Did I just leave from her? Oh no, she's on the ground. Okay, let's do that. Let's do a physical, abdominal. Let's run all this test. Do her temperature too. Let's follow her. I think they're gonna take her to the ER. She's got hydrated. Yeah, they're gonna take her to the ER, which they always take the critical to OMC ER, believing that the doctors can save with advanced medicine. Okay, so let's see what they can control and what they can't. Okay, let's do this micro sampler, which is the collection sample from the patient's body fluid. Let's do that. And then I'm gonna just go ahead and do it for her. Of course, that's not one of our patients. Back to the bathroom, buddy boy? Oh, he's going into the room to just watch us. Going back to the desk. We have about 1minute and 29 seconds to heal patient Peter Scott and Michael Harris, which Michael Harris is in ICU. He does not seem like he's getting better. He's still in shock. And Mr. Scott, I'm not really sure what's wrong with him, but he's doing so. Okay, so Kareem is definitely about to attend to this patient. Welcome to OMC, Mr. Walker. It seems like he has renal contusion. Okay, we're gonna go ahead and give him that, do a CAT scan, physical, and send him straight. Oh, we can't do that. He's had nausea, hematura, and we need to do that and this. He needs oh, he's getting. Okay, he's being treated right now, but I think Gonzalez, where's he at? He's performing, but on who? Okay, you know you have a patient downstairs, right? Okay. All right, we have about 1minute left to do all this, and if not, we fail. They're gonna take $5,000 away from us. Right now in the bank, we have about $887,432. So I guess that money is just there to take money away from us every time we can't fulfill the needs of what's happening. I think next I'm gonna do like I was thinking we was gonna get more patients. So I guess the more days that you do, the more of the event that goes on. Also too, Yeah, I know I was gonna get to the part where I was telling you guys I was gonna delete this over here and start making new foundation to add on to OMC just to make it bigger. But unfortunately, they use that area, but I think they use all path areas. Okay, Karen is collapsing. Where is she? Okay, cold blue, cold blue, cold blue, cold blue. So we're gonna do all this. Let's do oral air exam, oral heart monitor. Okay, let the doctors try. Let's do a CAT scan and eval. Draw blood, CAT scan and eval, and are you getting urine? Let's watch her. She's probably gonna be taken straight directly to the emergency room. Probably gonna be put right there. Okay, what's happening to Mr. Garcia? Seems like you don't really know what's the test saying. Let's see. Let me switch to cardio. Waiting for a bed. Let's get you on EKG. If not, we just definitely get you a diagnosis. I'm not really sure. Saying that he has renal confusion general. I think we can put him in ICU. Seems like everything has been suppressed, but it's immediate for discomfort. Okay, you getting better, Karen? Kate, I mean? It's not Kate, Miss Barkley. Alright, let's do a physical exam. Let's do a neural testing and abdominal in the chest. Let's get that done, pronto! Okay, Mr. Wright is collapsing. Let's go to him. Cold blue, cold blue. Alright, so I think we just lost that event. Alright, it's okay. We was able to catch, keep the patients. Alright, so let's see. What's this one? Natural disaster, epidemic, or crash. Let's do this one. Incident has been declared a significant earthquake has hit the region and caused major damage to property as well as causing a large number of injuries. Local hospitals must prepare to receive casualties. OMC is about to receive 2, 4, 6, 8 people. OMC. So this ER is about to get jam-packed. We're about to get jam-packed. But that good thing is that we have beds. Oh, I thought we had beds available. Why did everybody what the hell? How did we have how people just automatically come to these beds? Yeah, I don't know how these beds just was filled when just a minute ago we didn't have anybody in these beds. Okay, it seemed like somebody was just dropped off at OMC. Okay, welcome to OMC. Miss Hernandez. No. We still. Let's see. I need this. Transport to room. Because we're gonna need every available bed. He's still having problems. Oh, he had the irregular heartbeat. Okay, welcome to OMC, Miss King. We're gonna do everything we can possibly to save your life. We're gonna start administrating these treatments that's available. You'll have a lot of examination here under the care of Mr. Clemons. Seems like you have this problem. Let's do that. Let's do this physical and this and that. And let's suppress these things. Seems like your fainting is high, but we're going to give you that emergency care. And she's not out of the woods yet. She is still fainting, okay, in and out of conscious. All right, so let's see, Mr. Wright, do the eval in the urine so we can overrule these for the CRP. Okay. Ms. Barkley, let's go ahead and give you that. Let's go ahead and do the CT. Let's do the X-ray of this, but there's 14 possibilities. Okay. Welcome to OMC, Mr. Johnson. We're gonna definitely try to help with your problem. It seems like you have, okay, Mr. Clock is collapsing. Let's go to him. It's on the floor. Okay, cold blue X-ray, cold blue X-ray. I mean, cold blue radiology, cold blue radiology. Cold blue radiology, cold blue radiology. Let's set this out. Okay, he's treating Mr. Johnson. Alright, so yeah, so let's make sure we have beds available for the critical. Okay, welcome to OMC, Ms. Garcia. We're definitely going to assist in helping you with your pain. We're going to order some tests on you. You're being under the care of Mr. Taylor. We're going to try to suppress some of your vomiting. We know you're vomiting. We know you back pain. What's this, a hematoral? What is this? A blood urine. So we have to get you on a catheter, right? We have to put a catheter in you? Okay, let's do a urine analysis. Right now we have all these. Okay, so we have to now start putting people. Okay, you're waiting in a bed. You need an ice wrap and a medical emergency care. Let's do a fast on you. Okay, we have a busy emergency room right now. We have 2 plus 8 patients. Okay, where are you going? You're going to exam. Let's go ahead and do that X-ray, MRI. I know our MRI is going to be filled over there in radiology. So we have another person coming in. Welcome to OMC. Okay, let's go. Hold on. Okay, Mr. Gonzalez, welcome to OMC. We're going to give you something for your pain. We're going to do the emergency care. We're going to be doing a bunch of examinations on you, starting with your blood pressure, and then we're going to do a speechless, and then you're going to be under care of Mr. Gonzalez. So are you guys brothers? Okay, this is your brother. Yes, this is my brother. Okay, we're going to fast, and we're going to do blood draw. We don't know what your diagnosis could be, but it's going to probably be, oh, we can't switch over there. Okay, they said that Mr. Garcia was collapsing. Where's he at? Okay, it seems like he's heart failure. They're shocking him. Okay, oh, that's why they walk away, because it's staff lunch. Okay, no problem. Okay, so it seems like we are suppressing that. All right, hopefully you pulled through, Ms. Garcia. Let me come back to Dr. Clemons. Is going to go to James Wright. We have a busy emergency room. Okay, welcome to OMC, Mr. Moore. We're gonna go ahead and give you some of these treatments to help you with your pain. Okay, you will be under the examination of Mr. Taylor. Just stay in your line right now. We do have another. Let me see what's going on with this guy. All right, did the cold blue lobby, 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 cold blue lobby. Why is nobody going? There's a code. Cold blue, cold blue. Cold blue, cold blue. so long to respond to this, man. Oh, I can't believe it took this so long. Maybe because I don't have enough patience. Where's this guy from? I'm not understanding why we did the code and it's taking so long for them to come. Okay, welcome to OMC. Okay, so we're gonna go ahead and do this. Okay, welcome to OMC, Mr. Johnson. Nope, that's not him. It's this guy here. Okay, welcome to OMC, Mr. Martin. You'll be under the care of Mr. Martin. Okay, are you guys related? All right, so we're gonna go ahead and give you something for your pain. We're gonna do an examination on you to suppress some of your problems. What's up with you? We still don't know what's going on. You're on a heart monitor. Let's see. I'm not really sure on that call. All right, Mr. Gonzalez, we're gonna go ahead and do a CAT scan, and we're gonna do a neural test, and we're gonna do a physical exam. And then Mr. Moore, we're gonna go ahead and give you leg casts, do an X-ray and a physical exam. Mr. Taylor, Dr. Taylor, will be right with you. Mr. Clark, we're gonna go ahead and do a CRP in the urine, and then we're gonna also do a CAT scan test. And Mr. Taylor will be right with you. Dr. Taylor will be right with you. Where is Kareem? Okay, he had to visit somebody upstairs. Mr. Anderson is visiting. Okay, so do that X-ray on him, and we still don't know what his problem is. Oh, this room just got filled quick. Okay, Miss Barkley, we're gonna go ahead and give you some medication that's gonna help you with your pain and also with your fatigue and your fever and chills. Okay. We're gonna see if we can transport you to your room up there. All right, over there to internal medicine. You get better. Okay, Mr. Lee, we're gonna give you something for your pain. We don't really know what you probably have that or this, but whatever it is general. So let's see if we can get you there. You're waiting for a bed. Okay, let's see. Mr. Williams, let's give you something for your pain, your thirst. We don't really have a clear idea what's happening with you. Okay, let the doctors try. Okay, Miss Gonzalez, we're gonna get something for that. We're gonna order you on a heart monitor because we don't really know what that is. We're gonna give you do an X-ray on you, see what that happens. We'll turn out to get the results for that. Foot contusion, Mr. Anderson. We're gonna give you some of that. Miss Barkley, you're still here, and we're gonna give you something for your pain, and you have carpal tunnel. We're gonna see if we can switch to this department. Then start the surgery, and then you have cramps and all that. So yeah, okay. I know, our CAT scan test is all the areas filled over there. Alright, let me see. There's all our patients here. Okay. We do. So you guys are waiting. I have not even been on the floors already to see what's happening. Let's do all these tests on you, Mr. Clark. Okay, Reno, they say we can put you in ICU, but we're just gonna do a physical exam on you. General, you have a high thing, so maybe they might start doing surgery on you real quick, because this here is not good. A CT scan revealed confusion in patient kidney tissue, and he needs abdominal. And he has that red thing, and he has. I don't know. Let's see. Is it comfort? No. If we put you on ICU, you're not gonna. Let me see. Let me just hold on. Let me go up to general real quick. Just real quick. Let me just go to general. want to see something. Do we have any beds available for general? I don't think so. Now we don't have any beds available. Okay, so let's see. You're almost done. Okay, let's say we could put you in ICU. It look like you're getting done. Alright, let me see what's up with you. Orthopedics. Let's see, what's up with you? No way. What's up with you? Okay, so I think for now we just have to switch them over. Okay, we have a surgery going on right now for Miss Hall, Jennifer Hall. No, it's not Jennifer Hall. Christopher Johnson is having surgery on a spleen. Okay, so if anything, we might have to just put some patients on this floor from the emergency room. Okay. So what do we do? Okay, ICU. He's gonna call, I bet you. Okay, we're gonna do that. I bet you he cold. Okay, look like she's happy, Miss Williams. Show you. Alright, somebody's coding. Cold blue, trauma room, cold blue, trauma room. He's having heart failure. Okay, he's coding. Come on, Mr. Wright. Elevated LDL. Raise LDL cholesterol. Blood level above normal range. There's no more test we can give him. We just have to hurry up and diagnose him and see what it is. So he may have these problems. Let's go ahead and do this and see if we can go ahead and do the surgery. Come on, come on. Okay, we're gonna go ahead and order these other tests on you, Miss Barkley, so we can determine your diagnosis. You have a lot of diagnosis that it could possibly be. See, without having a history of these patients, it's like could be very hard. I guess we determine from their symptoms what possibilities of their diagnosis, but since we have it up as certainty for the emergency room, it's gonna give us what's possibility if it's chance. Okay, so okay, shockwave. That's what I'm saying. Like, what department is that? See, that's how oh boy, okay, make it work quickly. Where will our shockwave be in cardio? Wait, hold on. Okay. Do I have to hire somebody? Is it this? Do I have to hire somebody? Cardio. Okay, I don't know. Shockwaves. I mean, is this it here? So how do I make a shockwave room? Let me see. On call. Well, I don't really know what to tell you. Can't be treated. Oh goodness. Oh my god. Let me see. That's all I know. Alright, we need a shockwave. Isn't that what he needs? Okay, a shock. Wait, right? Lithotripsy. When you come back, Mr. Hall, we will have that for you. Okay, so let's see. Where's regular hospitalization at? Okay, that's because our beds are full up here. Okay, you waiting for regular hospitalization for here. I mean, it's that we don't really know what you have. So let's see. You're waiting for surgery. Okay, let's do that. This, and this, and that. And we don't really know what's going on with you, but if we can, we can just switch you there. Because eventually you're gonna need to go there. Okay, what's happening to you? Let's do a CT, wake you up, so we can continue to rule out these possibilities. Alright, we have yours. You're still here. You're not getting any better. It doesn't look like your satisfactions. I'm gonna go ahead and put you in ICU so we can fix this. Patient is leaving. Yeah. Okay, no problem. No problem. No problemo. Because we really can't help you, fortunately. Oh, but he has a smile on his face. R. Kelly now under criminal investigation. What the hell? Yeah. Okay, so it looked like he has a big smile on his face. So we must was able to help him. I think. I'm not really sure. Hopefully. Okay, yeah, sorry about that. That was something that just popped up. Oh my god, Mr. Wright died. Is this the one that was in the ER? No, he died in... Darn, we gotta do this surgery. See, I didn't even come over here to my patients. Okay, hold on. We have a death now. Okay, so Mr. Wright died. What's going on with you? You still have pneumococcinus. Meningitis. You still have meningitis. Patient got incorrectly diagnosed. According to performing examination, it's not possible for the patient to have this one. Let's see what we're saying. Okay, so he doesn't have that. Okay, so let's take that off. So if he doesn't have that, okay, let's go to him. Cold blue emergency room. Cold blue emergency room. Cold blue emergency room. Cold blue emergency room. Okay, so okay, no problem. Hold your line. I need to go back up here. Okay. Okay, you're being... Okay, you're leaving out of... Wait, where are you going? You're being transported to room. What room? So you leaving ICU? Okay, Miss Harris. Okay, let me see where Charles Brown is going to. Okay, we're gonna do some of this for that. Okay, so we have somebody that just came to Richard Clark. He was just in the emergency room. He coded a few minutes ago. So they brought him up here to ICU. Abdominal surgery. Let's see if we can give you these treatments here. Okay, so... Alright, so let's see. Right now, let's see if we can admit you here. And let's do this. And then, if anything, we can just switch you over. Wow, that's a hefty bill. Okay, so he should be going to his room. Let's touch him for a minute. 15 minutes and 51 seconds to cure Jessica Hernandez, Michael Gonzalez. Alright, he's going to a chair. I'm not really sure what chair he's going to. Uh, Michael Zala and Christopher Martin. We already cured Christopher Johnson, Jessica King, Donna Garcia, and Robert Moore. We already cured them. So, okay, Richard Garcia is collapsing. Is that the one in cold blue, 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 cold blue? Okay, so he's having heart failure right now. Come on, shock him. Okay, so this is his. It's 2 heart failures. We don't really know what's happening with him. Okay, you look like you'll be leaving soon because you're getting better. You're not getting any better. You're soon to be better. You're soon to be better too. Wait, what? Oh, I'm about to say, I thought that was a patient going to another patient's bed. Okay, you're not feeling any good. Let's give you that and your cardio. You need a surgery done. Oh, patient died. Wow, they were unable to save him. Wow. 30 years old, an athlete. He died from heart failure. So we didn't know what these possibilities. Darn it. Okay, darn. Okay. Look like you're getting better, Miss King. Mr. Hernandez, let's give you that, let's do that, let's give you this. And you need to go to infection. You have to advance. Okay, what's wrong with you, Mr. Wright? You need some of this. Let's put you in ICU so we can free up some of these beds. Okay, you need to go. Okay, you're going to ICU? Did I just put him in ICU? No, it was him I just put in ICU. Okay, this. Ooh. Ouch. Let me give you eye drops. Let's do a CT. Okay, let's see what's happening with you. What are you on your cell phone? Okay. Okay, need some of that. Alright. So I think we did as much as we could with our video on this side, right? Let's go downstairs. Look like a surgery is about to happen on Mr. Jones. Okay, let's go down. See what's up in our ER. So we still have a couple of patients there. This is, you rarely see this happen, but we do have a lot of patients still here. So we don't know what yours, so let's continue to do these tests. Let's see what your problem is. Mr. Martin. You need to go to general, but you have you have something going on, an infection. I'm gonna go ahead and send you to ICU. So that's available. Let's do a temperature on you. Let's get some more tests ran on you. Wow, 600. What was your problem? Mr. Moore. Wow, he don't need, he's good. Nice, nice, nice. Okay, Let's see. Waiting for bed. Okay. You're still waiting for a bed too. 23. Alright, let's see. I guess no when you don't go ahead and give them a diagnosis. Yeah, say, oh, you diagnosed them wrong. Okay. Alright, so these are our patients in the emergency room. There's Kareem doing his thing. He has Clark, Cole, and Gonzalez as his patients. Alright, so we need 1, 2, 3 more to heal. We need Jessica Hernandez to get better. Let's see where she's at. Okay, so these are all the patients that we have here in the hospital so far. Okay, so what's all this? So 4 left, 85. Right. Oh, these are the people who died, and these are the people who left. Okay, so Garcia died and Wright died. Okay. And Lisa Harrison Hall left because we didn't have those type of medicines for them. Okay, these are, what is this? These are clinic patients. We only have 5 on site now. Let's go to Jackson. What's wrong with her? Kidney disease. Let's ICU her. And Wright, let's see what's happening with her. Where are you? Oh, you're walking around. You have renal failure. Let's put you in ICU too. Okay. Uh, being hospitalized. Going to a doctor. Uh, you need the same thing. Okay, let's do this. Let's do that, and let's do that. Might say they give a wrong diagnosis. Okay, these are our patients where? Okay, these are what? Clinic patients about to be hospitalized or something? Wait, you're hospitalized? Okay, okay, these are all hospitalized. Okay, so this is a hospitalized clinic, bookmark, untreated on all patients. Okay, nice. Okay, so let's see this. These are all the people that are in the hospital. So hopefully Peter Wilson leaves soon, cause looks like he's getting better. Wow, we don't lab uncover go to. Okay, so well, I don't know what to say. Is okay? 22 night shift change. Okay, so the clinic is closing. All right, but what's wrong with her? Where is she going? She's supposed to be going to ICU. Okay. We still need Hernandez, Gonzalez, and Martin to get better. Now they just show all this now. I need to see just the patient, just these patients. Alright, I guess you want to send it to me like this. Alright, so Hernandez, hold your line, Adams. Okay, where is Martin? Martin. Why is that even up here? Just take me to Martin. Oh, goodness. Patient is collapsing. William, where are you at, William? Cold blue, cold blue. We have no doctors. Change the shift. Cold blue, cold blue. Cold blue, cold blue. We have two. Well, a great time to collapse at the height of changing shift. Cold blue, cold blue. And ICU, cold blue, cold blue. Cold blue ICU, cold blue ICU. Cold blue ICU, cold blue ICU. Come on, people. Cold blue ICU, cold blue ICU. Where you guys at? There you go. Where's my other patient? I knows. They're coming, they're coming. Cold blue, cold blue. Alright, there was another patient that was collapsing. Cold blue, cold blue. I'm gonna do that and bloating, thirsty, and dehydrated. We can start him on antibiotics. Night shift. He probably went home. Yep. And now the daughter's here. Where's the daughter? Okay, there she go. This is my daughter who works here. Okay, so I'm gonna do one more round over here, and then I'm gonna go ahead and end this episode. Let's check up on right. We can give her that. Thank you for being here at OMC. Mr. Green, give you that. Oh, Kareem Clemons is treating her. Lisa Hill. Okay, we're gonna give you that. Welcome to OMC. You're in the best care here at OMC. It's a full house today. Mr. Adams, welcome to OMC. We still don't know your diagnosis yet. Mr. Walker, we're gonna need some eye drops. We're gonna do an MRI. This, you're in the best care here at OMC. Do that. Welcome, Mr. Scott. You're here. You're gonna have a X-ray of the lower limb. Welcome to OMC. Barbara Barkley, you're still here. I'm not really sure where you're going. And Patricia Jackson, we're gonna give you this, and you're still waiting to go here. You're still waiting for bed. Let's start that for you. Okay, so let's go downstairs in the ER and see what's happening with everybody here. All right, Hernandez, you're still waiting for a bed, right? We need to find out what's wrong with you. So let's say abdominal pain, bruise, abdominal. Let's do this. I'm gonna say, let me see. You need abdominal surgery. Okay, why they can't diagnose you? Chills, elevated weight loss, breathing problems, fatigue, night sweats. Maybe you have TB. Okay, let's do this. And if it's a wrong diagnosis, then put that on me. Okay? Hopefully, you'll get better and get out of the red. Alright, so... Okay, what was I doing? Okay, here you require abdominal surgery. This is a medicine, abdominal surgery. Okay, we can just do that and then start you, put you in ICU. If it's a wrong diagnosis, it's more me. Got it, that the stock exchange just closed. Okay, thank you. General, you're waiting. You have what's wrong? You have an infection. You need surgery as soon as possible. I still don't know why there's no, there was no beds available up there. You have renal. I'm gonna go ahead and switch you here. Okay, no problem. No problem. No problem. Here, let me see, you were here. Okay. Alright. Well. Okay, well. thank you guys so much for taking the time to be here. Okay, we're about to have another surgery. I guess that's with all the problems that come with OMC from all the other departments, from general medicine to internal medicine to orthopedics to our emergency room, neuro, cardiology, radiology. Thank you so much for taking the time to watch this episode. I guess this is the chaos that happens here at OMC. I'm Kareem Clemons. Thank you so much. And I'll see you guys on the next stream. You guys have a good one. Peace.